Traditional advance directives such as the living will and power of attorney express patients' choices in general terms for their medical care. More recent directives such as the physician order for life-sustaining treatment, the POST, are actually medical order sets for reflecting what the patient's preferences for care are. What we have designed in the Advanced Care Planning Toolkit is an additional reference and resource for documenting the content of a discussion between a patient and a physician regarding their goals of care, their values, their preferences for medical treatment. And it is a much more substantive document which explores the patient's situation as it reflects their preferences for care. The toolkit also includes a discussion guide which prompts the physician with a set of questions and reflections to clarify the patient's preferences and goals of care in their own words as much as possible. Our overall desire with this toolkit is to document and clarify the patient's preferences. It can be billed during the course of an annual wellness visit or in the course of a regular nursing home visit as a separate service, as long as both elements are met. The advantage for the patient in an annual wellness visit is that they are not responsible for the copay for the advanced care planning part of the visit. This service can be performed by a physician, a nurse practitioner, or a physician assistant. Well, everything in advanced care planning matters. During an advanced care planning visit, we might explore what the circumstances are leading to the discussion. Does the patient give consent to the visit? Does the patient have the capacity for having this discussion? What are the medical facts? What are the options for treatment? What prior directives have been made? But although all of these are important, the most important consideration is clarifying and articulating in the patient's own words what their values are and what their preferences are for their care. The discussion guide encourages a process in which we seek to discover and elicit from the patient in their own words what their preferences for treatment are. We all know that there is a critical need to promote patient-centered advanced care planning. But advanced care planning must be more than just checking a series of boxes on a form. Patients have the right and the need to have a meaningful and substantive discussion of advanced care planning with their physicians. This discussion guide and documentation template offers a framework for conducting and documenting these conversations. AMDA will be making this resource available to its members as soon as possible, and AMDA is exploring collaboration with outside entities, perhaps in some licensing agreements or other means of introducing this toolkit to the healthcare delivery system in such a way that patient preference will be documented and available through the digital space as easily as possible. I would anticipate that CMS will be looking to see what impact these advanced care planning visits have on actual decisions and whether they reflect actual patient preference. We believe that this advanced care planning resource tool is well designed to continue improvements in care planning as we move forward and encourage its distribution.